and good morning, friends. So I know there are very wonderful audiences here. I was just going through the names and realized that few of our African friends have joined. There are people from India is also there. So friends, namaste, good afternoon, good morning, walaikum assalam to all of you. So first of all, I just want to do the basic testing. So friends, how many of you would like to cure yourself or your near and dear ones from sickle cell disease? Type me if you are interested. Great. Serious responses. Good, good, good. And how many of you would like to know the means and ways to save money or arrange finances for the treatment while you are doing the treatment from the best of the doctors and hospital? Again, type me if you are interested to know that. Wow. Good, 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 good. So friends, first of all, thanks for your time. And today we are exactly going to focus both of these two points which we have discussed so far. So friends, you all know that sickle cell disease is an uninvited complex disease and with very limited treatment options. So what happens? We often need to take our near and dear ones to the hospital, either for transfusions or to manage the sickle cell crisis. And still, even after doing all these things, we always live in fear. Nobody from us would like to see our near and dear ones either in pain or struggling or counting for the days. How many of you friends would like to come out from these ongoing struggles permanently, not temporarily, permanently? If you're interested, one more time write me for me so that I can get assured I am speaking to the right audiences. Wow, good, good, good. So friends, as I discussed, these are the two topics. So we are going to discuss first the new advancements in the technology to effectively manage and cure sickle cell disease. And this first part of the session is going to be absolutely clinical and focused on technological advancements for the cure of sickle cell disease. Because when we talk about the permanent part of it, we essentially mean to cure rather than to manage it. And my friends, in the second part of the session, we are going to have a discussion about the money aspects and what you can expect in that, how we can save money, those who are looking to arrange funds, what are the better ways, what could be the better fundraising strategies, etc., etc. There's a hell lot of things there. So be there up to the last part of it, right? So friends, now coming to the main agenda of it. Today to focus upon the first part of the session, which is the clinical part, where we are going to talk about the advancement of a technology to cure the sickle cell disease. We are going to have two most famous names of India who has established mastery and authority. You mean mastery and authority in the field of sickle? They are just not the newcomers in the field. They are actually the masters of the field. And why I'm so confidently able to say that? Both of them has experience of more than 15 years and jointly they have done more than 2,700 bone marrow transplant. And this is the combined number, by the way, let me clarify. And this is a team which is also well known for the latest in the world, which is typically called CAR T cell therapies, and they have already done around hundreds of a number. These are the guys, my friends, or the docs, or senior docs, who have done their education from absolutely the premium of the institutes, and they are trained in the best of the hospital across the globes. These are the guys, docs, my friends, who are followed by young breed of a doctors. Typically, if you want to take an appointment, you would need week to 10 days. And if I need to share my personal experience for them, I could never manage an opportunity, both of them together, and I am having beer with them. So courtesy to all of you, my good friends and a guest, today both of them are going to be together with us. So it's time to announce the names. So we have Dr. Rahul Bhargava, who is currently the head of the Department of Haemato-oncology of one of the premium hospitals of Fortis Group. The name of the hospital is FMRI. And Dr. Vikas Dua, who is currently the director of Pediatric Haemato-oncology. On behalf of the audiences, I would like to welcome both of the docs to the Medico Experts Patient Awareness and Guidance Program. Welcome, Dr. Bhargav. Welcome, Dr. Dua. Guys, you can also greet both of them in the chat box, please. But it is highly appreciated. Trust me, these are the guys very difficult to find.
Thank you, Dheeraj. I think it's a wonderful time. And
Dr. Bhargava, so many highs, thanks are coming for you.
Thank you, Dheeraj. Thank you for the warm welcome and a great job which you people are doing to create awareness about
guys, thank you on behalf of both of the doctors for an overwhelming responses. So many messages. The screen is scrolling like anything. So we are coming to the session. So with all of your permission, I would like to invite Dr. Bhargava, and he is going to share his experiences for some time, and he's also having Dr. Dua with him. So first few half an hour or so, whatever they would, it's like the blessing, guys. Whatever they are going to share today, consider them a blessings, because you are going to hear absolutely from the horse's mouth of the best. So it's over to you, Dr. Rahul.
Thank you, Dheeraj, for giving us this opportunity, and wonderful people from all across the globe who has joined in their precious times to discuss about sickle cell, which is a burden not on the society, but as a nation, in the world as a whole. And Dr. Vikas Dua is in pursuit of doing the wonderful things for sickle cell, for eradicating sickle cell, not by doing just bone marrow transplants, but working on prevention strategy as well. At FMRI, we are 15 physicians who works together to create a magic and treat people suffering from sickle cell disease. So Dr. Vikas Dua is the lead consultant and the innovator in this space for sickle cell, where he brings in new therapies right from a sibling transplant to a half-match transplant on the board to cure sickle cell people. So what, dear friends, sickle cell is all we know. Sickle cell is not different or not new to these audiences, because we know that we are born with a disease of SS, where we can suffer from bony pains to stroke to recurrent blood transfusions to acute chest crisis, priapism, avascular necrosis of the hip. So any of these problems can create a great anxiety and pain and loss of economics in your own countries at this present moment of time. So what do we have an offering in sickle cell disease is what we need to understand, and how the world is moving. So world is moving towards not only by prevention, so it means we should try to check sickle cell SS or AS status before we get married. Even if we get married and with an AS status, then once the baby is in the womb, we can check for the baby, and if it is SS and if your religion permits, then we can go ahead and do the abortion. But not every time baby is going to be SS, even with both parents being AS. The best combination is AA, but yes, the life is not always bed of roses. Next thing is the drug therapy. The plain and simple, once we have diagnosed it, what is the diagnosis test? Dheeraj, I would request we all should give them a point of care testing in Africa. Whosoever is joined in, we should go back and talk to them that we will be able to provide them with the kits so that they can check their neighbors, their near and dear ones for sickle cell for free of cost. So I think that will increase the awareness for sickle cell disease as well. So once we have tested, the simple test is the HPLC test, which comes in one day, and this cost is not more than $5 to $10. So once we know that you have a sickle cell disease, then the problem and things start, because it's such a varied disease. It is not like a cancer, okay? It is worse than a cancer, because in cancer either you live or you die. In sickle cell, you keep on suffering, dear all. That's a major problem for all of us. So what do we do? So there are drugs which are available. Hydroxyurea is one which is available, which can be utilized by all of us to increase our HbF levels from the childhood so that we can prevent sickling crisis. We need to take pented prophylaxis. We need to give vaccination to prevent the capsulated organisms causing a havoc in our lives by causing pneumonia and so on and so forth. So we need to have that medications ready with us. So one portion is the medicine point. Second is the bone marrow transplant, where you require a special test called HLA typing and not the blood test. So who all should get an HLA typing done? So me and Dheeraj were talking about it, and I said every sickle cell disease patient needs to get an HLA typing done. Why? Because multiple papers, dear all, has shown the younger the age group, lesser the money. And Dheeraj, thank you for raising this money. Money is still a problem. So as you grow in your life, your weight goes up. So as the cost of the drug goes up. As you grow up, your organ starts getting a beating up from various complications of sickle cell. So they are not so amenable to take this brunt of doing a transplant. So you get more complications. One of the papers published from US says that the best time is to do in less than 13 years of age. The best time to do a bone marrow transplant when you are younger than 13, because that's where you get a success of 90+%. 90% people will survive. So you see, the question is, when do we want to get a transplant? You have a severe disease. There's a criteria laid down for a severe disease. What is severe disease? More than 3 crises in a year. You are blood transfusion dependent. Just a minute. So you have got more than 3 crises in a year. You have got recurrent chest infections. You are transfusion dependent. You have a stroke. That's why, and that's where you require the bone marrow transplant at the earliest. So dear all, the moment you are diagnosed as SS, along with the blood group, please get your HLA typing done. You don't require a blood group to be matched. You require HLA typing. Very, very important is HLA. If you have a pen and paper, please write it on a paper. What you require is a high resolution HLA. What you require is a high resolution. And with Dheeraj, at various places, we will do an HLA camp, which will be free of cost, where you can get your HLA typing done to know whether you are a match within your family or not. But we are in a shrinking world. What is happening is, I don't have 7 brothers sisters like my mother had. I have got only 1, and my son has got no brothers sisters. So how do I get a transplant done? Either through a match unrelated donor registry, we do a match unrelated search and then do a transplant, or we do a half match transplant. Dear all, that's a revolution in the medical sciences, that I can now do half match transplants as well. So very, very important to know that half match transplants can be as good as a full match, provided we do it early. Yes, the cost goes up to $35,000, but they're as good as the half match transplant. Very important thing to understand that these are the things which are now available in today's world, which can be done so that these people can be cured, and these people get cured by doing these transplants. So what is a transplant? Dear all, you get an HLA typing done. Whosoever is hearing this, there's a hope. Please understand, you should spread this word of hope that the bone marrow transplant can cure sickle cell disease patients. So once we have a match, what do? We get your checkup done, and the donor has got no problem. So if Dheeraj is my brother and I have to donate for him, or he has to donate for me, he has to donate 300 ml of blood from the vein. He just have to donate 300 ml of blood and nothing else. So there is no problem with the donor. So you don't have to think like a surgery, dear all. It is not a surgery. Bone marrow transplant is not the surgery. It's not a surgery at all. It's not a surgery. Okay? It's a plain simple transfusion, which we need to understand and we need to move ahead. So once we have an HLA typing done and you are planning to come to India, what we need to do is, once you arrive in India, we get the blood test done, the cardiac evaluation done, the kidney evaluation done. Once that is done, you are subjected to chemotherapy to wipe out all the bad cells from the bone marrow, or the stem cells which are producing the sickle cells, you eliminate it. What is the conditioning regime? Flu-Bu ATG, fludarabine, busulfan and ATG, and the cost of ATG goes up. It goes up. Why? Because if I weigh heavy, if I weigh 70 kg versus 30 kg, the cost is going to get double. So when people say, oh doc, why can't we do that in $20,000? I say, you bring a 5 kg kit, we will do it in $18,000. You see, the drugs are directly proportional. The cost is directly proportional to your weight. That's a very, very important understanding for all of us. And that's why we say, try to do it early, try to do it early, try to do it early. It is not that we want that. It is the science which says that we need to do things early to get the greater success. Once that is done, you are inside the hospital within a HEPA filter room. We are manipulating your product from the vein. So it's not a surgery. You're not cutting any part of the body to put in the stem cells. You put the stem cells from the vein and they go and disappear within 24 hours and start forming red blood cells, white blood cells and platelet in 10 days, 10 to 14 days. They start producing cells. But does it end here? No. The second phase starts after the transplant, which means that 100 days and beyond, you have to worry for the GVHD, graft versus host disease. And you have to also worry for hypertension or
I'm coming.
Or other complications. Once you crosses that, you are ready to go back to your country. Once you are ready to go back to your country, for next 365 days, full year, you are on some immunosuppression called cyclosporin. And you are on cyclosporin, and after 1 year, you stop and start living your life normally. So very, very important to understand that this is what the transplant is all about. When we say 90%, yes, dear all, we have to understand there is a 5 to 10% kids or babies are not able to tolerate the medication, and they can lead to the mortality or the death during the transplant or up to 1 year about the transplant. In a nutshell, transplant is simple. Transplant needs to be done early. Transplant is not a surgery and nothing happens to the donor. That's the most important crux. And even if you don't have a full match, then you still can do and go ahead and do the half match transplant, which will help you to get cured of this painful crisis, or say painful crisis as well as infections or avascular necrosis of the joints, because avascular necrosis itself is an indication to do a transplant. And after 1 year, baby can live a normal life. So many of our patients have gone back to Kenya, but it's not 100%. Dear all, when we come, we think it's 100%. No, it is 90%. Science has made it possible to move it from 0 to 90, but not 90 to 50. We still have to travel that 10%, and that 10% can only be traveled if we do the transplants early. So I think it's a very imperative thing. Dr. Vikas Dua travels in various countries in Africa. The Dheeraj organizes many camps in Africa for sickle cell, because that's a very dear thing to our heart, because our own Prime Minister has said by 2047 we want to make the country sickle cell free, and that only comes by doing more of research as well as screening. And there are a lot of money which is being spent over screening in sickle cell disease. So I think future is bright for all of us. We would like to ask for gene therapy. Yes, there's a beautiful article published in Lancet Haematology about gene therapy versus bone marrow transplant, but still the jury is out and telling that bone marrow transplant is still the preferred mode of treatment for sickle cell, and the only cure for sickle cell at this present moment of time. So I think very, very important to understand that we need to promote, we need to propagate this good word of people getting sickle cell transplant done at the earliest stages, and then we can proceed ahead for the future, brighter future. So all of us, we know the second largest population of sickle cell are in India. HLA is not a surgery, it's like a cheek swab. You can take a HLA from a cheek, or you can take a HLA from the blood. It's a DNA test.
So, Dr. Bhargav, you explained really very well. And one of the points I seriously appreciate you try to answer very categorically, because most of the patients are having this particular doubt. What is the right time? And there is a misconceptions which are going on. The later, the better. But thanks for you to addressing it.
I said today is the right time.
Right.
For every sickler, I said today is the right time. Not today, tomorrow, but today is the right time for doing a transplant.
So, Dr. Bhargav, is there anything you would like to address, or shall I invite the questions from the patients?
Please invite the questions, because it will be more important to ask their queries in their own local language where we can solve them.
Sure. So, my dear friends, we are entering into the question and answer sessions. You are requested to put your questions into the chat box so that we can streamline. And if somebody would like to come online to speak to the doctor directly, please also write to the chat box, and we will create an opportunity for you to become online with the doctor.
How long does one have to stay in India? Is about 3 months. Do I continue my immunosuppressive lifelong? No. What are the complications of transplant graft versus host disease, where the stem cells of a donor which has been put inside, they fight inside the body to cause loose motions, eye problem, skin problem. But are they manageable? Yes, they are manageable. What happens if my graft gets rejected? Yeah, it can happen in 3 to 4% people. Graft can get rejected as well. So these are normal complications, and that is why department is equipped with 4 pediatric hematologists, 4 adult hematologists, infectious disease specialists, geriatrics, clinical pharmacologists, nurse practitioners, 26-bedded transplant unit. So everything is there under one roof. So many people will say, let's do a transplant at a X center. That could be because there's only one doctor. Here there's 15 doctors, the team. And the team which makes this dream fulfill. This team which makes dreams into reality. And that is what we are very proud that Dheeraj and the team works together to bring hope into the people suffering from sickle cell anemia.
So, Doctor, I would also facilitate, because there are 2 sets of questions coming. There are few questions which are targeted more to the organizers, which I am able to see on the screen. Few people are putting for everyone, which you are also able to see. So I would also help you to ensure that we are answering everybody's question. So there is one question I am first taking from everyone category. How can I end this sickle cell disease once and for all? I guess
by bone marrow transplant. By simple bone marrow transplant. Simple, simple, simple. Please find a match within your system. Please get your HLA typing with your brother and sister. I'm telling you, future is bright. The gene therapy will come, but still the gene therapy is so goddamn expensive that none of us can ever afford. So I think what remains the standard of care is bone marrow transplant.
Doc, may I request you, because our audiences are typically not all from a healthcare fraternity. So can we talk about bone marrow transplant in, or shall I attempt some language and you can correct it?
Bro, please.
So friends, bone marrow transplant is a particular procedure whereby there is something called a bone marrow which is responsible for production of your RBCs. So if that particular area of your body is corrected, which means the root cause of the problem from where the cells are being generated, sickle cells are being generated, that is the area, that is a particular area which has been cured by the transplant mechanism. And how the transplant happens, as Dr. Bhargava has mentioned, that one donor would give some 300 ml, and that donor has to have an HLA match, which means that the recipient body should be able to receive it without any complication, right? So it is typically taken from the siblings, Doc?
Yes, from the siblings. From the same mother, father, which is called a sibling transplant, where the success is 90%. When it comes to half match transplant, the cost is 70 to 80%. That is called half match transplant. And today's world we are saying half is as good as full.
So the friends, in earlier days when we were not able to find the fully match, it used to be a problem, a complication. But with an advancement of medication, even the half match transplants is a reality. So bone marrow transplant is essentially taking something from the sibling and infusing it into the patient's body, not as a surgery, but it's the blood procedure which is going to be done. And that's how you can eliminate the sickle cell and correct the root cause of it. Till the point you are not going to correct the root cause of it, it's a management stage, which means the crisis will keep on coming, the transfusions would be required, and so on. So I hope we are able to answer. One question, Doc, I'm moving on next one. Can a child of 3 years do BMT?
Yes, any kid above age of 6 months can do a transplant.
Sure, great. What is the total cost? There is one question from a direct category, Doc, I'm taking from that. My daughter is 25-year-old and has seen one of the best doctors in the world, Dr. Joes in the UK. She's done well for last few years, but last year was very bad and it would like to proceed with BMT. My daughter is a twin and the HLA typing from her twin is 50%. This is Annie. This is a message from Annie. So Annie, would you like to come and speak and explain a bit about your daughter?
Or even if you're not doing that, the simple thing is please send your HLA. We can search in the registry for a match unrelated donor transplant. If we get that, then the chances of success increases. Otherwise, at the age of 25, half match transplant comes with own set of risks at this present moment of time. So I would suggest to you is that we would like to know more about it through a WhatsApp chat, which Dheeraj can establish with you. He can send his number to you and we can then chat onto that. But at this present moment of time, please do share your HLA, which you say is 50% match.
So here I would like to pick up one more point. So guys, we discussed about the fully matched siblings, which is match HLAs. We discussed about half matched, where the case like of an Annie, we are talking about a half matched. Now Dr. Bhargava has also mentioned is an unmatched donor. So what is this registry doc and how it is typically the process done, and what is the time frames typically it take if you want to take from a registry? What are the pros and cons and benefit if you
So very
can
nice.
a bit?
So I think match unrelated donor registry are the group of people in this world who has pledged their DNA or they have their DNA done, and that DNA is done on DNA report is put on the registry on an Excel sheet. So if my HLA, there's a chance in 1 in 50,000 that my HLA can get matched with any of those persons who are put on that registry. So if that gets matched, it takes 2 to 3 months to get the stem cells. So it can possible that today I'm sitting in India and my match is in, say, Israel. So that person in Israel will donate out of his humanity 300 ml of blood, which will fly to India and will cure me. And though there is a cost to that registry, any registry can charge you from 6,000 to 8,000 euros to $12,000. But dear all, the success chances with mud versus haplo versus sibling lies between sibling, full match versus half match. So match unrelated donor transplant is interesting. We should all try to search for a match unrelated donor in those families who does not have a match, full match patients.
Great. Thanks, Doc. So, in summary, those who are not having a matched donors or a half matched donors, please don't lose your hope. There are solutions even for that. And this is typically called unmatched BMT, and it's taken from registry. Doc, next question. This is a question again from a direct window I'm picking up. It is from Chukwembel, Nigeria. My 8 years old daughter requires allogenic stem cell transplant, but unfortunately, we don't have a donor in close family. Can we get a matched unrelated donor in India? How long? I guess this is precisely Doc has answered. Yes, the
Please
possibility
share your
is
HLA with Dheeraj. Please share your HLA with Dheeraj, and that will increase that will help in searching for a donor for you, which we can come back in 48 hours.
so. There are few questions with respect to the cost. I have a patient of 26 year. Friends, with respect to cost, I would rather suggest there is rather than a generic cost, it's more dependent upon case to case basis. As Doc has already mentioned, it the weight parameters which will help to determine the cost, the matching criterias which will help. So the with respect to cost, we will discuss a bit later. Let's focus more on a kind of a clinical questions where we can take a best use of doctor's presence now. Uh, Thanks for the presentation. There are some thanks. I need more light on what a full and half matched transplants entails. Who is this? Esther.
So very
Esther.
simple. Here, the full match transplant is where your HLA, which is A, B, C, D, R, D, Q, is 10 out of 10 match. Okay? Half match is that all these DNA are only 50% match with you. Or it could be 60%, could be 70%, 80%, but they all considered as half match. So if it is either it's a 10 by 10 match, or it's a 5 by 10 match, 6 by 10 match, or 7 by 10 match on a HLA. So what we are talking is about HLA typing. HLA typing. So we are talking about HLA typing there. And that is where you have to match the numbers, whether you are 100% or 50%. And that is what makes a difference between transplants with HLA fully matched sibling less than 10 years of age. The cost is around $20,000 to $22,000, in which you can get the transplant done with 90% success. But when it comes to half match transplant, that same money goes up to $35,000 with 3 to 4 months stay in India. Stay remains almost the same, but the complication rates in half-match transplant increases by 20%. The chances of complications is more in half-match transplant than a full match. That is why we keep on telling that if you have to do it early. Do it early, less than 7 years of age. You will get the desired results at the earliest.
Thanks, Doc. I hope your question is very well answered. I would like to know if the screening test is HLA-B27 PCR.
No. It's HLA, high resolution HLA, which is done for organ transplant. HLA-B27, there is no use, dear.
Okay. Thanks for the clarification, Doc. If a patient is 21-year-old, is BMT advised in this age?
Yes, at the age of 21, it is advisable, sir.
Okay, thanks, Doc. I hope what are the potential long-term effects on fertility and reproductive health after a bone marrow transplant?
Yes, after bone marrow transplants, we do get infertile. That is why we save blood, we save sperms and eggs before transplant is done.
Okay. So there is one question. Name is Poonam. I am a 30-year-old. I have a sickle cell disease. My operation done total hip replacement. Then after HIV come in my body. So it's possible for a replacement?
So right now at the age of 30, we will not prefer to get a bone marrow transplant done. But I hope you are already on hydroxyurea and antiretroviral drugs which are provided by the governments.
So, Madam Poonam, I would like to suggest is we will organize one-to-one consultation because this is going to be too personal and it would be difficult for a doctor to answer in summary here. So, I would ask my team to be in touch with you and we will organize this, and we are going to discuss in a subsequent session how we can do it, have a one-to-one consultation with the doctor. So another question, Doc, years back, the BMT was very expensive and 99% people could not afford it, but now manageable. So at a 25 years, can we still do BMT? Yes, dear. I guess Doc has clarified it. 25 years, 21 years, not an issue. If the full matched bone marrow, full matched donor is there, absolutely not an issue. If there is a half matched donor, there are some complications which are anticipated. Am I summarizing right, Doc?
Absolutely.
Thank you. Is there any question? How long, one question is, how long does it take to see improvements after BMT?
Immediate, within 30 days.
Okay, thanks. Is there any question, team? If I'm missing, please highlight for me so that guys, another 2 minutes if you are having, from my understanding, all the questions has been answered. If still anybody would like to ask another question, there are another window of 2 minutes, then we can assume that the questions are done and we will move to the next session, which is going to be more of financial sessions. In the meantime, Doc, I want to say something to you. Shall I?
Yeah, please.
Doc? Thanks a lot.
Thank you, Dheeraj. Thank you for this opportunity, Dheeraj, because it's a shared future. As told by our Prime Minister, one future, one nation, one future. This is our future being together to remove and eradicate sickness from the world. How we can contribute. That's our contribution to these people and to us. That yes, we need to do this and we need to educate people, impart knowledge, share our wisdom together that yes, bone marrow transplant is no longer a last modality. It is one of the best modality, in the first modality to cure sickle cell and thalassemia, people suffering from sickle cell disease or thalassemia. So I think future is bright. With more power to you and to your team that who continues to drive this agenda of sickle cell free world, not only India. I congratulate your whole team who has taken so much time out to combine the dots to bring this magical moment with and sharing our own experiences with our patients.
So seriously, thanks for your absolute wisdom and your time. I know how busy you are and it's how difficult it's to catch you, but serious thanks that you are here with all of us, sharing your years of experience in a juice form, in a summary form, and it's really very difficult to get.
Thank you, Dheeraj. Anything required, please do fix up one-to-one calls and we'll be more than happy to do that. Bye-bye, friends. See you sometimes. Thanks, Dheeraj, for bringing us in here.
Sure. Thanks, Doc. Thanks a lot. So if there are any questions, we will keep you posted later on. Did you enjoy interacting with Dr. Bhargav? Great. Not so many responses. Yeah, it's started coming now. Thanks. So the second aspects, my really dear friends, we understood that so far. One, sickle cell disease is no more like a kind of a situation or a condition which is not curable. It is very well curable. Second take home I would like to say from Dr. Bhargav's address, sooner is the better is the key. It's no more kind of a thing. You are going to keep on deferring. It's going to bring more complexity. The age is going to increase the cost further, complications further. Third, if there is a sibling who is fully matched, that's really great. There cannot be a situation better than this. But even if it is not fully matched, half matched, there is a solution today. Even if not even a half matched, yes, again, there is a solution called a registered donor from a registry, which is an unmatched donor. These are the 2-3 ways, but we can particularly and categorically say that sickle cell disease is now curable. And seriously, thanks to all the technological advancements and the docs like the Bhargav and the Vinod Dua who have been doing quite a lot of research on that, it's possible these days. Now, guys, we discussed. How many of you want me to move to the next section, which is the financial strategies? Let me see the responses. I guess nobody is interested. Guys, you want me to focus on finances? Strategies,
Yes,
how to optimize your money and things like that?
Yes, you can go ahead.
You can go ahead. Thank you. So, team, I want to present some slides. Can I have access to share my screen? Is my screen visible?
Yes, it's visible.
Thank you. So there are always two parts of a treatment. One part is definitely the clinical part of it. We must have to be in a good hands with the good doctors and a good infrastructure. And another part is always, which is very important for people like us. What about the finances? How to arrange the finances? How we can do it? So this is going to be a session. I'm going to focus upon some insights, and let me also share what is the basis of these insights. Medical experts has been doing quite a lot in our bone marrow transplants, and we worked with so many patients and helped them to address this particular parts. And this is particularly a summary of one of my team who is absolutely focused on helping the patients on their finances. So I can categorically say it's it's the summary or the juice of around 200 patients whom we have helped so far. So that's how it is, and let's move it. The first question is, there are something called in tricks, there's something called in a strategy. Why do we need a strategy for even a bone marrow transplant? Answer is very simple, dear friends. It's a costly treatment. It's not a few thousand of dollars. It may go tens of thousands of dollars at times. Second, it's a complex treatment, which means that it is not a treatment that anybody of us can go in any hospital with any doctor, because the doctor and the hospital must have to have a good infrastructure, have a capability to manage the cross-functional complications if it is coming, which means this is particularly a kind of a treatment and a procedure one must go, I would say must go in a right hands at a right place, which is sufficiently equipped to manage the complication, not just related to the blood, but the rest of the organs also. Because when complication, although it comes in 10% cases, 20% of the cases, but even if it comes, then the hospital must have to be equipped very well to handle the complexities. So when we go for such kind of a hospital, it makes more costly. Typically, if we are talking about a routine procedures like knee replacements and the things like that, even if we are going in a relatively smaller hospital, it works. But in bone marrow transplant kind of a treatments, it makes sense that you should be in a good hands and at a good hospital, which is having a good infrastructure. So which means it is not a small problem which can be handled by small tricks and tactics. It is something, there has to be a planned way to address it. So far, we have learned in this world how to save money. So we have been trained, negotiate well, or plead. Am I right? Is there any second opinion? These are the two ways we have been learned throughout our life. Yeah, I am a right page on my audiences. So I am getting that. But my dear friends, the fact of the life is hospital does not negotiate. Because they are having so many patients like you. Everybody comes, tries to plead, they have been, and it doesn't work simply. How sophisticated a hospital is to communicate that, it's a different thing. But the matter of fact, they don't negotiate. Pleading never works. Right? So these are definitely not the two ways by way you can save the money. So again, I would like to highlight there are two kind of a problem statements. If I'm having a sufficient money, how I can reduce my burden. Second part, I'm also going to discuss a bit. If I am not having a sufficient money, what all one can do. But the first thing is, even if you are having a money, negotiation as an individual never works. Pleading doesn't work at all. Then what typically works? Not an individual can negotiate. Then who can negotiate? Organizations who are having a big numbers, big volumes to talk, which can talk about 20, 30, 40, 50 procedures. Then what happens? And typically what happens? When we do something in a bulk, the cost of a procedure itself is reduced because of all the components, all the medicines which are required, the processes which are required. When the hospital is able to order it in a bulk quantity, then definitely there is a scope the overall cost is reduced. And in such cases, hospital and doctors are willing to pass the benefits to the patients. So if not an individual can negotiate, but a big group can definitely negotiate. Then the question is how to create a big group. A big group, and who should be the one who should facilitate the negotiation and try to ensure that it's absolutely coming a win-win situation? If none of us can individually, then who can? Guys, it's very difficult job. We are sitting at this point of time around 35 people here. Who can do this job? It's very difficult to identify from an individuals. But what's the solution then? I'm here to give the solution. Solution is medical experts. Yes, we do have that capability to influence. Why? Guys, we are working in 20 countries. We do have a friends like you. But the problem typically happens that nobody is synergized. To create a group, a synergy is required. A time combinations is required. But still, we are able to help many. But at the same time, let me be very candid with you. We are not able to help everybody. Because when we plan, people have other priorities. When we completed our activity, they come back to us. Now I want to participate. This becomes pretty difficult. So that's the reason we are able to help many. But at the same time, we are not yet fortunate enough that we can help everybody. So this is one way how we can negotiate. I have shared. Now I would like to say that even if we negotiated, we can't expect like a big negotiation into the numbers, because definitely some kind of a negotiation 10-15% can definitely happen. It can't happen like that. Anybody, particularly the good hospitals and the big hospitals, are going to give it in a absolutely economical cost. It's not going to happen. So many of us, in our experiences, we found that many of them, our patients, are required for a fundraising. So if we are not having that much of a money, then what is the next option? The people go for a fundraising. And here also, with our experience, we found that there are so many people who are doing it right, but at the same time, multiple more peoples. If there are 10 people who are doing it right, 100 are doing wrong. They are just struggling, not getting the right results, not able to raise the funds, even to save their lives. So how the typical world works? The typical world says that I will go to my friends and family. Some say that I will take some government grants. Few approaches to the employers. Expect employers to pay. Few approaches to the charity organizations. And you can guess what is the problem. If there is somebody who has tried the fundraising, you might still be able to visualize it. It's simpler said than done. Governments, unless and until I got an opportunity to interact with many governments, at least if I'm able to, in African countries, personally met more than 25 government officials at a ministry levels, but there's nothing which we could have arranged for the patients of that country. Friends and family, limited resources, whatever the resources are. And the matter of a fact is, if you are able to manage with these resources, perhaps I'm not required to guide you anything. If your friends and family is so financially strong, nothing like it. Go ahead, do it. But if these mechanisms are not working, if your employer is supporting you, perfectly fine. Go ahead, it's a good way. There's no doubt that this mechanism is not a right mechanism. But what if all these things are not working for you? Where shall you go? Is there any other option? So our research suggests, my friends, there is a new ways which has started coming, and people are able to raise the funds much more effectively. And it's a new trend, I would say. It's the crowdfunding. It's like that if I need to raise $1,000 from one person, it's a Herculean task. But if I plan to manage $10 from 100 people, it's very simple job to do. But this crowdfunding is also having its own problems. Let me very candid. It's not a simple way to do it. But theoretically, the quantum which you are passing to somebody is very reduced. I have taken an example of $1,000. Try to think about a $10,000. If you are going and asking somebody to support you for $10,000, it's really a Herculean task for anybody to support you, be it your friend and family, be it a charity organization. But if you try to manage it, $100 from 100 people, $50 from 200 people, it's a manageable task. So let me, we worked quite a lot with many patients on this crowdfunding aspect. Let me share what is the challenges you should expect in this. First thing is a trust. If you plan to approach 100 people, how do they trust you that your requirement is genuine? With respect to money, irrespective of the boundaries, be it in India, be it Nigeria, be it Zambia, be it Kenya, be it Uganda, any African countries, when you ask money, trust becomes the first factor. Second, individually, how many people you can reach? There is a physical limitations. Not 100 people you will reach, all 100 would be willing to contribute that even a small amount. There is no way you can follow up if you approach somebody. And last is, we are human beings. We do have our own self-respect. Either you say self-respect or a shyness, it comes into a picture. And that's that many people are not able to do the crowdfunding. So what's the solution then? These are the problems which has been encountered. Solution is trust. There has to be a right documentation from an independent organization of repute, which the people can trust that if you are raising X amount of fund, then this is genuinely a requirement. This has been verified by somebody. It is not happening that somebody is requiring $1,000 but looking up fundraise for $2,000 or something like that. Because as a donor, these doubts starts coming. If you're not able to visualize these doubts, try to visualize if somebody will come to you asking for $100 to donate for a treatment, what kind of a doubts you will start getting in. So you need to have definitely a very right documentations, supporting by the report, supporting by the doctor's suggestions, the budgets and things like that. So trust you would be able to address. Then the second part, these days platforms which are available. These days there are platforms which are available where people can see how much Friend, I will take the question bit later. Let me complete it first. I will take the questions bit later. There are certain platforms which are available today, which gives your audiences a complete visibility. If you are looking for $10,000 of a raise, how much it is raised, how much it is pending. So everybody who wants to donate is able to visualize the right situation of yours, and most of the time they are able to extend their pockets when they are able to see the difference between the fund which is required and what you are able to raise. Once you are using a platform, you are not going individually asking for money. What is typically you are required? You circulate your requirement in your own community and referring to the link of a platform where there is a transparently showing that having all of your documents, records kind of a thing, that is a genuine requirement, it is required for that. These are the verifications, and this platform owners are going to definitely do their due diligences and ensure that all the requirements which are posted are genuine. So what you need to do is just start circulating it into your community, and this platform owners also provide you some help to extend it to some charity organizations and the things like that who are doing the regular donations. Platform can send the follow-up message. You don't need to follow up each individually. So the documentation along with the platform start becoming a solution. You start percolating it, divide the problem statement of a $10,000 into 10,000 divided by 100, 10,000 divided by 200, and you would be able to raise that much of amount. Now the question is, interesting question. How many of you would like all this to happen in an assisted mode? Let me see the responses. If there is an interest, we'll discuss it further. Guys, not a sufficient interest. I guess nobody's interested in moving forward, how it can happen assisted mode. Not still. Still, it's, I guess 5, 7, okay, 8, 9. Not everybody is still okay, but this is my job to respect those who are interested. So thanks, guys. Okay, now it has moved to the 15-20. Okay, good. Great. So thanks for all the direct messages or the public messages which you have sent. So we definitely respect your views. So yes, there is a means and ways whereby we can combine both of these two things. Yes, medical experts can help you. Let me candid with you. Those who are genuinely looking for it, guys, medical experts is with you. And we can help you. But at the same time, you need to understand that there's something which you also need to do. This cannot happen. It's like a handshake. Even if medical experts can and intend to do, still it will not work, provided you don't take any actions. So, what are the constraints we do have? See, this part of supporting people in a fundraising and arranging some discount is not our key I would say, agenda. We definitely do it when we got in a touch with so many patients. We get inclined, and when we find many people who are looking for it, then at times we do it and even support it with whatever basis we can do. So this is our constraint. It's not like that we are routinely or a charity organization or something like that, or a kind of organization whose main focus is this. No. Yes, we are a global virtual hospitals. We are doing the surgical camps in 20 countries, having a presence, having a panel of doctors, around 1,500 doctors, having presence in Africa, Middle East, SAARC countries, doing business there in those countries, taking our Indian doctors there, performing the surgeries, all such kind of things. So we are very limited with respect to our bandwidth, and that's the reason we prefer to work only with the people who are seriously looking for this assistance. So it's seriously not for those who are just kind of a thing, let's see what happens kind of a thing. So we are seriously, we would respect those guys. We don't say they are wrong in any way, but we are seriously not first choice for them. At this point of time, we can accommodate for this mode of arranging some discounts and helping them in a fundraisers, only 10 patients, my dear friends. It's not like that we don't want to do it, but we do also have other obligations, other commitments. And this is, I already said, is not part of a core agenda for medical experts. So yes, at the same time, we are also inclined to help our patients. We travel so much across the globe for the patients. So yes, we can definitely help few of them. And the current approval from the management to enter into this CSR mode of this is like a corporate social responsibility kind of a mode which we take occasionally, and it's only for a 10 patients only. So this is the constraints, and due to the constraints, this is the bandwidth which we are having at this point of time. So what is it you can expect from the medical experts? So medical experts, you can definitely expect the discounts, whatever the prevailing rates are going on. We are often very easily able to arrange at least 15-20% discounts from the prevailing market. And when we talk about the big treatments, this 15-20% becomes a big number. Like if you talk about 20% on a $20,000 bill, it becomes $4,000. It's a really significant number. 15%, it becomes $3,000. And support in fundraise. Yes, we are connected with many fundraising platforms, and whenever we feel that the people are needing it, we support them and introduce to the fund, and they support. Although we can help you, but they will also have their own due diligences, because any fundraising platform, they are very seriously want to live to their reputation of a transparency and getting engaged with the genuinely needed persons, so that this crowdfunding cannot be misused by anybody. I'm not saying that the people here are planning to misuse it, but it's a matter of a fact that few people even misuse it. That's the ground reality, and we have also seen in our experiences. So if we get associate, or for example, few of you who get this opportunity to participate into it, this is what you can definitely expect from medical experts in your journey of cure of sickle cell disease. So what you need to do? if you are inclined to participate in that. And typically whenever we do this patient awareness program, so some quota need to be ascertained. So the first step is to ascertain the treatment and the cost. As I mentioned that this exercise must have to be very transparent exercise. We can't move ahead with the generic approximate numbers because our reputation comes on a stake if it is in approximations. So this must have to be an accurate number, a certain number. And in this particular session with Dr. Bhargava, we understood that there are multiple parameters with which the treatment cost varies. The match, whether it's a fully match, it's a half match, it's an unrelated donor. Second, what is the age at which the patient is looking for? So there are multiple factors based on which the cost is going to vary. Before we want to get associated, we want to be absolutely sure, particularly in a fundraising, that we are able to provide very transparent information, authentic information to the world who are going to support you for their fundraise. So what is required for that? We definitely require to have one-to-one personalized consultation with the doctor. And those who are going to book the consultation first will be supported by the medical experts. So our constraint at this point of time, even if you want to engage and even if we want to engage, you first need to ascertain that whether this particular case is doable. If it is doable, what is the transparent success rate we can expect? Third, what is going to be the cost implications? These are the 3 steps for that one-to-one consultation is definitely required as a mandatory first step for us to engage with you for discounts, for help in fundraise. Next, what needs to be done for the consultation? Very simple. Those who are outside India, the consultation charges is $50. For Indians, the consultation charge is 2,500 and you will be interacting with the same Dr. Bhargava or his team, like the second doctor which I mentioned, Vinod Dua, because he is a pediatric, Vikas Dua, who is a pediatric oncology, Haemato-oncology specialist. And if we are able to ascertain that, yes, medical expert would be willing, and I'm also sharing that we will not be able to take more than 10 in this particular drive of it. As per my information, some 4 slots are already booked by the patients who get associated. So in practically, there is a 5 to 6 slots which are available with us. And why this consultation charges? If you're thinking that these are the consultation charges we are interested in, seriously, no, my friends. These consultation charges are typically the consultation charges. Even if you're going to visit to the hospital, you would be paying being into the queue. So our interest is not knowing this consultation charges. And even if when the treatment is having, you can assure from our side, these are the charges which are going to be waived off. But these are the charges which shows your interest, which shows that you are willing to take actions. And the slot of this time, which we want, should go to really genuine and serious guys who genuinely need the support. They should get it. It's not any kind of a business model for us. It's a support activity But at the same time, we really don't want to waste our energies and our limited bandwidth if somebody is looking for just from a window shopping and a casual approach of this and that. No, it's not for those. So 6 slots are available, my dear friends, to show your seriousness, to show that you are taking in actions, to, if you believe that medico experts, yes, I would like to give you, if you don't believe that medico experts can help you in doing that, please don't take any actions. I would like to myself recommend that. But if you believe that medical experts can help you saving your money and arranging a fund, then definitely take action first. What is action? For non-Indians, for people from abroad, $50 consultation charges, and these are typically the charges any doctor in India of that level takes. For Indians, I hope Indians already understand that doctor of this pedigree and experience, these are typically the consultation charges. And this is the consultation which is going to happen through the video consultation one-to-one. And you would be able to interact once more the same Dr. Bhargava who was here. When to do it? Now. Team, can you please forward the links so that everybody get a very fair opportunity? Everybody get a fair opportunity to join this drive. I really don't want if somebody is left behind because the links are circulated late or early. We genuinely want to give a very fair opportunity to everybody. Guys, you can definitely plan that, and you can expect what I shared earlier, support in a discounts and support in fundraise those who are looking for. Links are already in their chat box. So is there any question on a fundraise? I would prefer to take. In the meantime, guys, I just would like to mention that very seriously, 6 slots are there. The first 6 are going to be benefited. Later money which is coming would be refunded back to the people. We seriously don't interested into the money part of it, but we are very want to focus upon the 10, 4 are gone, 6 are left. There are 6 slots. Please take it if you wish, but taking action on a timely basis is more important. So on a fundraise, that's the last note, my friends. I'm willing to take questions if anybody is having any questions on this fundraise. And my team would be in touch if somebody is getting problem in a payments and things like that. Team, can you please publish some numbers if somebody is getting problem? The centralized WhatsApp number or somebody who is can help them. Please put the numbers if somebody is getting some problems. Please ensure that we must ensure that we are very fair to everybody. So any questions so far? I wanted to know how long the chemotherapy. I guess Doc has left the session. He wanted till the point he was there, he could have answered better. And it also depends, in my opinion, about the conditions and what the condition, what's the weight, what's the age, kind of a thing. It's not a generic answer. The number of sessions of a chemotherapy. Just to reconfirm, yes, we will help in fundraising. Any other questions, my dear friends? Thank you. Thank you. Thank you. So in absence of these questions, my team is putting the numbers here. you can get in touch. The links are with you, and the centralized number from where you might have got the invite or you might have approached medical experts might already be with you. All the channels are open. Up to the 6 people, we are willing to help it out. And any other clinical questions, even if you want to interact with the Dr. Bhargava for one-to-one consultation, not for a long-term association, you can get in touch. The team will assist you from all perspectives. So, in absence of, is there any question? I guess the questions are answers, all answered. Any clinical questions? You guys are just and God sent. Thank you. Thank you. Such a nice words actually encourage us to do these activities. Thanks. Is the discount continuous? What does this continuous meaning? Can you please elaborate this question? Michelle, you have written a question. Is the discount continuous? Sorry, I couldn't understand your question. Can you please elaborate a bit more? I mean the immediate 10 patients. See, if we are enrolling you, we'll ensure that you are going to get the discounts. Because for us, this is not the question whether we will have 10 or not. The problem with us is we will not be able to give more discounts to more than 10 patients. So if we are getting committed, if we give the commitment that we would be able to arrange the discount, we will. So for us, that's not a question that we're able to arrange 10 patients or not. Problem always with us, how to say no after 10. Okay, I hope I have addressed all the questions, friends. Friends, now it's my time to say thank you to you for your time. And these are our initiative to ensure that everybody get a fair opportunity to get treated. Everybody get fair opportunity to listen from the best of the doctors of India and the world. And we also travel to multiple countries along with these doctors, do perform certain surgeries there. And recently we were in Nigeria. Very soon we are going to be in Cameroon. Ghana is also, my team is planning. So we might get opportunity to meet you guys there. If I might not be there, my team will be there. And we would always be happy to serve you in your own country, which is our prime objective. But as a part of the kind of a love you guys give us, we reciprocate by the initiative like this. Thanks, friends. Thanks a lot. Namaskar. This is Dheeraj. Would like to say bye to you. Thank you. Bye-bye.
Thank you. Bye bye, sir.